So, first of all, like, can you introduce yourself for the audience?
Hey, I'm Zach Long. I'm a physical therapist out of Charlotte, North Carolina, in the United States. Got a history in strength and conditioning before I went into physical therapy, and now I'm just really fortunate that I get to talk to people about everything on the spectrum of improving performance, from being injured to actually improving your performance and the things that you care about.
Cool. So, I really love the posts on your Instagram, and I really enjoy reading those stuff.
Thank
Is
you.
it so? I know that you last time I reached out, you your wife just born. I'm sorry about my English. The baby just born, right?
Yeah, so well, he's 8 months old, so we're a little out of the absolute um, horribleness that is the first 2 months where you're just completely sleep deprived, but we're still trying to settle into new routines. And every time we seem to figure something out, something else changes.
Is it better now?
It's better. Yeah, I'm at least getting more than 6 hours of sleep now, which I'm somebody that does not function very well on reduced sleep.
Cool. So the first question I want to ask is about the post about like the hip mobility and squat width. Can you like explain to us like how exactly can we find appropriate squat width for for everybody?
Yeah. So one thing that I see quite frequently is individuals that have read a post online or seen a YouTube video or has had a coach or clinician try to tell them that there is that everybody should squat a specific way. Like the general rule of thumb that you hear a lot of people say is like you should squat about shoulder width stance with your toes pointed straight forward. But really we see that a lot of individuals have very different hip anatomy, and so not everybody should be squatting with the exact same stance width and toe out angle. And if you look at lifters when you're in the gym and you're just looking around, you'll notice that everybody squats slightly differently. But where occasionally people get into trouble is, again, when they kind of get pigeonholed into everybody should squat this way, which is still something that is far too common. I still regularly hear and see people being coached that you have to squat with your toes forward. But everybody's hip anatomy is different in terms of how deep their sockets are of their hips. So the hip joint is like a ball and socket joint. Sometimes the socket is really deep, sometimes it's really shallow. You can also have different levels of rotation in the hip socket as well. So all of those things will adjust how you get set up optimally for yourself. And most of the time, just the easiest way to identify this on yourself is to start with a narrow stance, toes forward, do a couple squats, widen your stance a few inches, do a few squats, widen a few inches, do a few squats, and figure out where you feel most comfortable. And then from there, also adjust how far out your toes are. Do they point straight forward? Do they turn out 10 degrees, 20 degrees, 30 degrees, 40 degrees? And just play with those different stances. And most people then, after they spend, 3-4 minutes playing with different stance widths, will identify what position feels most comfortable, allows them to squat to the greatest depth, and does it create any pain or any feelings of like being restricted.
So you mentioned that everyone has like different hip like structure. Can I use structure?
Sockets is the word that I would use.
Socket. So as a performance coach, how could I help my client find a better way besides like the squatting, like you mentioned? Is there other way for coaches to verify that?
That's probably the easiest way. So, here in the United States, there are different laws in terms of like who can do hands-on stuff on people. And so in a lot of areas, like trainers and coaches, a lot of times in the United States, don't like to put their hands on somebody's hips and move the hip around and test their mobility like hands-on. They feel like that's a little outside of their scope. As a licensed physical therapist, that is inside of my scope. So when I'm doing this for individuals, I have them lying on their back and I just move their hip around into different positions. And very frequently you'll find an area where somebody's hip has the most available hip flexion. So where we can bring the knee the closest up towards their chest. And what I do then is I look at how where their knee is in relationship to their shoulder. So for instance, if I'm doing that test, and for some individuals, I'll find that their knee is, has a lot of flexion when it's just inside of their shoulder. For some individuals, it's going to be when it's a little bit outside of their shoulder. But I look at that positioning. That's what I do when I'm in the clinic. But I also coach. And when I'm coaching people and I'm in the gym, whether that's, I'm coaching a group of 3 or 5, or I'm coaching a group of 20 people, I typically just do more the adjust your stance. What does it look like when we go a little wider? What's it look like when you toe out a little bit more? I think either way, you'll come up with the exact same answer. You'll just do it just differently. So I would say for most people, it's just as simple as just adjusting that stance width a little bit, toe angle a little bit, play with different positions and find what works best for the person in front of you.
So, is this deadlift stand width same with the squat width?
The deadlift stance width, you'll see, if we're talking about the conventional deadlift, we will typically see a lot less variation than we do in somebody's squat. Most people's deadlift stance is going to be about hip width. You will see people that will adjust their toe out angle slightly, but not near as much as you will see variations in the squat. Or if you look at Olympic weightlifting, which is going to have similar setup position to a deadlift, you'll see most individuals around hip width stance. But in the Olympic weightlifting world, you will see a little bit more variation than in the powerlifting world in terms of their stance. In the powerlifting world, you can get into the discussions of like conventional stance versus sumo stance with individuals. But if we're talking straight conventional, there's not a ton of variation in people.
Why is that?
To be honest, I've never been asked that. And I really think that probably more than anything, it comes down to your arm position in the conventional deadlift. So the longer your arms are in the deadlift, the stronger you're going to be in that movement. So if you go really wide with your stance in a conventional deadlift where your legs are inside of your arms, but you go a little bit wider with your legs, what that's going to do is it's going to push your arms out wider as well. And when your arms are wider, they won't be as long. They'll bring you down closer to the bar. So you'll now have to lift the bar from a lower starting position. So I think that puts us in a disadvantaged position. But it is also simultaneously hard to go much more narrow than hip width, because hip width is already fairly narrow. So where are you going to go from there? To your feet touching each other, which is probably not a position that most people have a lot of range of motion with. So I guess that would probably be the best answer for that.
Cool. So the next I want to ask is about like let me check the difference between like front squat and back squat.
Yeah, so there are a number of different differences there. Let's start from a mobility perspective with those two, and then we can talk a little bit about the muscles that are being worked in those two. So from a mobility perspective, we always have to think of the squat when it's a barbell squat. It's the bar you want to keep over the middle of your foot. If the bar goes out in front of the middle of your foot, then it becomes really hard for your back to have a good like mechanical position to lift that load from. If the bar is behind the middle of your foot, then you're going to fall back. Like you're going to fall into your butt. You won't be able to stay upright with that position. So when the bar is on your upper back in a back squat, now in order to keep it over the middle of your foot, you have to lean your torso forward a little bit more. When the bar is in the front rack position, it's already starting out in front of your body. So when you squat down, you'll typically see a more upright torso, because that upright torso will not push the bar in front of the middle of the foot. So front squat, more upright torso, back squat, more lean torso. And that's then going to indicate what happens at the joints below the spine. So in a front squat with an upright torso, if we're squatting to the same depth to parallel, if we have a more upright torso, we're now challenging hip mobility a little bit less in the front squat. In the back squat, as we lean over, hip mobility gets challenged a little bit more in the back squat. When we then look at what happens, like if hip mobility, if when we squat, we use more hip mobility, we're going to, as a result, use less ankle mobility. If we use less hip mobility, we're going to need to make up for that with ankle mobility. So in general, the front squat uses more ankle mobility and less hip mobility. The back squat uses more hip mobility, less ankle mobility. Those aren't drastic changes, but they're definitely noticeable, and they're important for some individuals that come with pre-existing issues. If somebody comes to you with hip pain and you're their coach and you're trying to keep them squatting while they have hip pain, then very frequently having them front squat is a great way to train the squat that might challenge their hip mobility or the hip joint just a little bit less than it does with a back squat. So it's just good to keep that in mind for the person that's out there in front of you. Or if somebody comes in and they have a history of like really poor ankle mobility and you want to work on that long term, but you want to have them squatting with good form right away, they might be a little bit better suited for back squats than front squats. So that's from a mobility perspective. Anything you want to touch on there or want me to hit a little bit more on?
No.
So then from a mobility perspective, let's shift to talking about what happens from a muscle perspective in the back versus the front squat. There was one really good study that looked at EMG activation of the muscles during front and back squats. And so EMG activation is a measurement, for people that aren't familiar with that, of the amount of nerve signaling being sent to the muscle. So if EMG signals are higher, that basically means that the brain is trying to recruit more motor units in that muscle. And so it's sending a stronger nerve signal. Now, there is not a one-to-one correlation between EMG activity and like muscle hypertrophy, which is very commonly misunderstood. People think that because an exercise has higher EMG levels, that means it's necessarily better for muscle hypertrophy. And that is not true. That's been shown in a couple of different research studies. But in the front and back squat research on EMG activation, they actually found that quad and glute muscle activation is pretty much the same in both of those movements, which then a lot of people misinterpret a little bit by saying, see, there's not a difference between the back and front squat since the EMG levels are the same. But again, EMG is not everything. So if we combine EMG with what we just talked about from a mobility perspective, I think that gives us a better picture of the differences between a front and back squat. Remember, in the back squat, we discussed that we see a more forward torso. We challenge hip mobility a little bit more. So the hip goes through a greater range of motion in a back squat with the same amount of EMG activation on the glutes. So the same amount of neurological signal, but done through more range of motion. I think that's why a lot of times when people back squat, they say that they feel their hips work a little bit more than their quads. Then when they front squat, in the front squat, remember we talked about having more ankle mobility. So people push their knees forward more. Pushing your knees forward more puts more of a stretch and more range of motion on the knees and the quadricep muscles. Same muscle activation taken through more range of motion. I think that's why people say that they feel that the front squat challenges their quads a little bit more than their hips. Those differences aren't drastic. Like if you front squat for 5 years and you back squat for 5 years, and we look at differences in your performance, if you're a rugby player, a soccer player, whatever, I don't think it's going to make a drastic change in your on-the-field performance. If you're a bodybuilder or an Olympic weightlifter or somebody that has more of those barbell or hypertrophy goals, those changes probably do matter a little bit. But I think, it's less important than if you go on like online bodybuilding forums that are talking about the differences. They'll say, oh, the front squat's not a glute exercise, it's a quad exercise. The back squat, that's a hip exercise, not a quad exercise. That's not entirely true. It hits both. There's just a slight bias towards one muscle group and one area of mobility a little bit more than the other.
Cool. So in the performance world, we usually use like back squat like a strength indicator or like strength level, how much back squat you're gonna reach. So that's strong enough. But nowadays there are more and more performance coaches talk about like they transform it to like front squat. Or they even do like they don't or now there are some coaches they just do like single leg squats. So what are your thoughts on moving from back squat to front squat and even like single leg squats?
So the difference between back and front squat, to me, it's that everybody is so like it is black or white. It is A or B. It is yes or no. And I'm very much, it's more in the middle. So I probably want more people using a combination of the two than being completely married to one over the other. Then you're going to, again, like we kind of talked about a few minutes ago, you're going to have different times where you maybe bias somebody's programming a little bit more towards one than the other. Like if somebody's having wrist pain and I'm doing a front squat cycle, but the front rack position's bothering their wrist, am I going to continue to try to piss the wrist off by having them continue to front squat? No, I'd rather switch them to a back squat. But overall, if somebody's healthy, I'd rather them just spend periods of time working on both skills rather than just on one of those variations. There is, and this is a little bit outside of like my general scope of like what I'm most familiar with, because I typically work with CrossFitters, Olympic weightlifters, and powerlifters, but you are seeing a push in a lot of the performance world towards people being more focused on single leg work alone. And you'll hear a lot of people discuss, not doing back and front squats, only doing rear foot elevated split squats and lunges and those sorts of movements. And a lot of times they reference what's called the bilateral deficit, where when you train one leg individually, you're able to get more recruitment of those muscles when you do just a rear foot elevated split squat than you do when you spread that brain energy across two legs doing a back squat. And that bilateral deficit is a thing. But again, this is not where I'm super in depth. So this is going to be like the extent of what I say on it. There is research on both sides of the equation there. You can argue from a research perspective on only doing single leg squats or doing double leg squats. And so I believe that the answer is that we don't let our bias get in the way here. We look at the research and some stuff says bilateral is good, some stuff says single leg's good. What the answer probably is that we should probably incorporate both of those. We should do some back squats, and then we should do some accessory rear foot elevated split squats. And then we should do other cycles where during periods of the year, we're only doing the single leg stuff. So to me, like, I think you said in our previous messages that you work more with like athletes than you do CrossFitters, weightlifters, powerlifters. Yeah. So for your athletes, in season, when you got a soccer player, rugby player that's already getting beat up from, the just playing their sport, do we then need to load them up with like a maximally heavy back squat that's going to create not only like stress on the lower body legs and stuff, but just the weight that you have to lift from a back squat creates a lot of overall body fatigue at times. So maybe in season for that athlete, you're not doing heavy back squats. Maybe the bulk of your training for them from a lower body perspective is more your rear foot elevated split squats, your lunges and things like that require less load to create a leg stimulus, but overall fatigues the body a little bit less. So again, the answer is and not or is kind of one of my favorite sayings that one of my mentors always uses, and not or. When people talk in like dichotomies of we only do things this way, that's when you kind of know you got to skirt away from those individuals.
Love that. So a lot of like powerlifters or like Olympic weightlifter or like CrossFit, they have like back pain, low back pain. Mm-hmm. So how do you have like assessment to know like which part of the body has like issue we should work on, and how should we be like working on that?
Yeah, so back pain is a challenging thing to discuss because there's so many different things that factor into back pain. So we have to think about it. So often when you talk about any pain with athletes, the two things that people want to talk about the most tend to be their technique with lifting and their mobility. But I think with people's back pain, we got to take a step further back, or with any pain, but especially back pain. Because so many different things will impact your body's susceptibility to having an injury or having pain. A great example of that is sleep. So there have been a number of research studies out there that show that when people don't get enough adequate sleep, that a number of different physiological responses go down. Your body's ability to repair muscle fibers and the collagen within your muscles and your tendons goes down. Things like your pain pressure threshold increase. So pain pressure threshold, for anybody that's not heard that, is basically take a little pokey stick and you poke on somebody's arm and you press down while you measure how much pressure you're pushing with. And then the person finally tells you at a certain point, hey, that hurt. And that is their pain pressure threshold, where the amount of pressure that you're putting down becomes painful. When you put people through periods of sleep deprivation where they don't sleep as well, you'll notice that their pain pressure threshold goes down. So it takes less for something to be perceived as pain. So there are so many different things from your sleep to your nutrition that can impact your body's perceived levels of pain. Your training volume also has to be taken into effect. Like if you're probably familiar with the Smolov squat cycle, right? So this Smolov squat cycle is something that was created with like the USSR Olympic weightlifting teams, where we're talking about elite lifters doing high volume, high intensity squatting. And that program produces really great results with those high level lifters. And so a lot of people like you and I, which maybe I'm wrong, but I'm guessing you're not an Olympic level Olympic weightlifter, correct?
Yeah.
All right. We were not designed to train that way. I'm not on performance enhancing drugs. I don't spend my entire life revolved around my training. I have other responsibilities in my life. So I can't recover from training like that the way somebody else can. So if I was to run something like a Smolov squat cycle, something's probably going to get injured because that is more training volume than I'm prepared for. That requires more recovery than my current lifestyle will allow me to have. I would need to sleep 10 hours a day and eat 5,000 calories a day to be able to recover from that style of training. So we got to look at the overall picture first before we then even start diving into the specifics of what might be leading to somebody's back pain. And so from there are a number of different things that I like to look at. So number one, if they're having pain with a specific movement, I want to watch them do that specific movement. Are they doing something that might be putting more load or stress on their low back that would then exceed the low back's ability to recover from that? Like an example of that would be like, what if somebody, when they deadlift, they don't engage their lats? And so the lats keep the bar from drifting away from the body. Think of like carrying your groceries into your house or carrying a box. You don't carry your groceries or a box like held way out in front of your body like you're doing a front raise, because having it far away from your body puts you in a mechanically disadvantaged position. You want to carry it close to your body. If you're not using your lats in the deadlift, that bar is going to drift away from your body and you'll be in a poor position to lift loads. So look at technique. Then I think you also want to think about strength. Specifically for the back, I think a lot of people lack like lumbar spine endurance. And I like to program a lot of low back accessory work. When you look at like the sports performance world and you talk about improving your athleticism, the muscle group that everybody talks about are the glutes. The second thing that people talk about are the hamstrings. And they might mention the posterior chain, which the posterior chain is a general group of muscles that we're thinking of the low back, or actually the entire spine, the glutes, the hamstrings, and the calves. But what they always focus their training on is the hamstrings and glutes. And I think a lot of people need a little bit of extra strength to the back. The other thing besides glutes that people talk about all the time is the core. And when they focus on the core, they're focusing on the abdominals, like your rectus abs, your six-pack muscles. And really, when we're talking about the barbell athlete, when a bar is on your back or in a front rack position, that bar is trying to round your spine over. It doesn't need the help of your abs to do that. Like your ab function is to flex your spine, at least your six-pack abs, your rectus abdominis. So actually what's probably more important for a lot of individuals is the opposite. We want to get your spinal extensor strong so that they can resist those forces that would be rounding your back forward. And so a test that I really like to use for that is a glute ham developer Sorensen hold. Are you familiar with that?
Yeah.
Okay. So for any of your listeners that aren't, you get on a glute ham developer piece of machine, and you basically do a front plank on it, but your hands aren't on the ground. You're just holding your entire body in a little bit of extension, and we measure how long you can hold that for. And I would really like individuals to be able to hold that for 2 minutes is my goal. I don't have any like big research studies to support me for that, but I just find when somebody can hold that for 2 minutes, their lumbar spine endurance is pretty good. And you tend to find that people that have low back pain or histories of low back pain can't hold it for that long. So that's a good test. And it's also a great way to work on strengthening your spine. You just start doing that hold for longer, or you do GHD back extensions, hip extensions, GHD rows, things like that. So that's what I like to look at from a strength perspective more than anything, is your low back strength in people that have low back pain, which also from just a general principle of strengthening the body when something's injured. When somebody has like Achilles tendinopathy, we strengthen their calf complex and we load that tendon. We try to make that injured tissue more robust. When somebody has rotator cuff pain, we strengthen their rotator cuff. And that's true for everywhere in the body. When somebody has patellofemoral pain, pain on their kneecap, we strengthen their quads. The back is not an exception to this. This is a rule of body health. When something is injured, you make those tissues stronger and more robust. When the back is injured, we get the back stronger. So look at back strength and endurance for a lot of your athletes. And then we can also look at mobility, where specifically the two big ones are your hip mobility and your upper back mobility. When those two are limited, you tend to see individuals that have to make up for that limited mobility a little bit with their back. And then also kind of third to that, a lot of times we'll see individuals with stiff ankles get put into positions where they load their spine a little bit more. So look at ankle, hip, and upper back mobility as assistance for that.
So you mentioned that thoracic endurance, right? And I totally agree with your thoughts on this, because I think it's like 2 years ago I also have low back pain, and I go to a therapist and he wanted me to do some corrective exercise, and one of the exercise is the glute ham exercise you just mentioned. And actually,
Cool.
actually, since then I don't have like much of a low back soreness or pain at all until now. But
Awesome.
why do you think that there's not a lot of like coaches or therapists talks about like this kind of exercise? And when they have like low back pain, they just told them to like rest.
Ooh. I think overall, in the world of spine pain, whether that's your neck or your low back, which are two of the most injured areas across all populations, I think we get very scared of those because there are instances where neck and back pain can develop to really nasty things. And I think our overall fear of the really occasional bad things that happen result in us being dramatically more cautious with everybody that has low back pain. And so I think that leads to us chronically underloading those individuals. And we have to remember, anytime we're trying to strengthen an area or create adaptive changes on the body, you have to challenge the body enough that it then says, oh, we need to make things stronger. And so in the low back, we get scared of loading the lower back. We get scared of trying to make those things stronger for fear of making things worse. But what ends up happening is because we don't load them, we don't create those adaptive changes. And I think that ultimately leads to us missing out on a lot of positive benefits that come from heavy lifting when it comes to people with low back pain. There's a lot of research out there right now on using deadlifts for people with low back pain and how beneficial training deadlifts can be for those individuals. A lot of that research, I do believe, is also really misinterpreted. So you'll find a number of different studies that they look at, like there's a study by ASA in 2015, and they basically looked at doing like low load motor control exercises like bird dogs and clamshells and dead bugs, like typically like really easy exercises that don't challenge the body very much. And then they looked at another group that did just deadlifts, and they found that both groups had the same reductions in their pain levels. And so a lot of people say, well, if we get the same reduction in pain with low load exercises versus deadlifts, why would I deadlift? I'll just stick to these easy exercises that don't scare me in having to load up the human body. But when you look at a lot of other research studies, like the Lift More trials are a great example of that. They had women with low bone mass, and they had one group deadlift and one group just do low load exercise. And we didn't see the low load group. They didn't see improvements in their bone mass. They didn't see improvements in their functional performance measures and their strength and their endurance and things like that. Another study by Tagliafieri and colleagues, they found that individuals that did heavy strength work for their low back, which included deadlifts and squats and things like that, they were less fearful of their back than people that did low load exercises, which is, I think, the really important thing. I mean, you and I both know a ton of people that come to see us to work with us as clients that have had episodes of back pain in the past, and they say, oh, I have a bad back, I shouldn't do this. That's what we call kinesiophobia, being scared of your body or scared of parts of your body. And that study by Tagliaferri and colleagues basically showed that people that lift heavy weights were then less fearful of their body. They were more confident in it. And I think that's maybe the most important thing we need to restore in people when they've had a bad episode of back pain. And that doesn't happen when we load people with light weights. It happens when we make people lift a heavy barbell off the ground. They stand up and their face lights up. They didn't think that they could do something like that. They drop the bar down, they hear it clang, and they feel like they're a really tough, resilient human being after training that way. And again, that just doesn't happen when we train with light loads. But that's my overall viewpoint on it.
I love it. So that's go for low back pain. And like you mentioned, it also goes for like some of our clients or our athletes have like neck pain, right?
Yeah.
So kind
Yeah,
of
for
want to
sure.
dive deeper into this. So is it the same with, let's say, if our athlete have like low back pain in they have like disc herniated disc in their low back or herniated disc in their neck? Is it the same?
Yeah. So let me take one step back from that. When we look at things like disc herniations, disc degeneration disease, different things like that, there have been a lot of research studies that have come out in the last 10 to 15 years where they take people with no back pain, no neck pain, no history of neck or back pain, and they take thousands of these people and they give them x-rays and MRIs. And what is shocking is that they find that a huge majority of people have those same findings on MRIs, even though they don't have pain. So that brings up like some weird questions when you hear that. Like if 50% of people over the age of 50 have a disc herniation on an MRI, but no pain, what does that mean about disc herniations? Are they really that bad? Another just insane study, they had a woman with back pain go and get, I believe it was 10 different MRIs, 10 days in a row, read by 10 different radiologists. And of all of those MRIs, none of the radiologists agreed on any similar findings. So every time she got an MRI, they found something different that didn't correlate with what they found the day before, the day before, the day before. So that doesn't mean that MRIs are useless, or that understanding, if you have a diagnosis of disc herniations, doesn't mean that that's useless. It just means that it's not as big of a part of the picture as we once thought that it was. I think it's a lot more important when somebody has pain to look at things beyond just those images. That is one snapshot in time with you sitting there or lying there in a tube for an hour that does not reflect what your body's doing over the course of 24 hours or a week, a month, a year. Instead, I care a lot more about your response to being in different positions or doing different activities or having different loads in your body. So I want to track when your body gets symptoms. Like, how does it respond to deadlifts at this weight versus this weight? How does it respond to a back squat versus a front squat? And I like to then say, these are the movements that are currently aggravating symptoms. These are the ones that are fine. We do a lot more of the things that are fine, and we figure out ways to make the things that are currently aggravating to progressively load those or change your technique or your positioning to make them to where they're not as bothersome as we build the body up and make it stronger. So the diagnosis of disc herniation anywhere doesn't change my clinical reasoning that much. It's way more important for me to understand your aggravating activities and come up with a game plan to attack those aggravating activities, regardless of what your MRI findings are.
So
I answered your question, but I didn't answer your question.
no worries, man. So for lower back pain, we have like thoracic endurance. What about like the athletes for neck pain? Is there like certain things they can do?
Yeah, so I like lumbar endurance and lumbar strength for people with low back. For the neck, a lot of times, a large majority of people with neck pain have stiffness in their upper back. And I think a lot of times working on upper back mobility, if that's limited, can really help the neck. but I also really like to do a lot of a more aggressive strengthening in the neck for people, especially as their symptoms calm down. I'm really big on shrugs, on heavy weighted rows, chest supported rows, bent over rows, band rows, like every form of row there is out there, shrugs, carries, overhead presses. Even in people that are like acute, like one of my favorite things to do when somebody comes in with a neck flare up is, what's the biggest muscle group around your neck? It's your traps. So I love doing shrugs and heavy rows and working the traps really hard, because when you have an acute injury, you have a lot of inflammation in an area. And one of the best things you can do when you have an inflammatory process in an area is let's pump a bunch of blood in there. Because if we pump a bunch of blood in there, we can dilute some of that inflammation. We can get through those initial stages a little faster. So I like to do things that challenge those muscles in ways that don't make it mad. And so often in the low back, it's things like that Sorensen hold that we discussed is a great way to do that. In the neck, I like to work the traps really hard because they're the biggest muscle there. I can create a big blood pump in the neck, and a lot of times that makes people feel a little bit better. But I do think that heavy lifting for neck pain is also like really, really, really beneficial for those individuals.
I thought we're gonna like release or massage the upper trap and like probably strengthen the lat and the lower part of the trap.
So a lot of people do feel with neck pain, they do feel a lot of tension in their upper traps. They'll feel constantly tight. And while some people might actually be tight there, I tend to find that more often than not, it's not that they're tight in terms of like that muscle being shortened. They're tight in terms of that muscle is holding on to more tone. It has a little bit extra tension on it chronically. And very frequently that happens when that muscle group is just being a little bit overworked. It's not as strong as it should be for what you're asking it to do. And so very frequently, when we strengthen the upper traps, a lot of that feeling of tightness or that tension goes away. But I will do things like I'll dry needle, I'll do soft tissue work, things like that to temporarily reduce that tension. But I tend to find that 80+% of the time in people that have tightness in their traps, that getting them stronger helps them out quite a bit more than just strengthening them.
Cool. Love this. Love this. Because uh one of my athletes, he had like neck pain, and I'm confused with this. And I think that's gonna help.
Good.
Appreciate that. So last question before I let it go, okay?
Okay.
And it's also a post on your Instagram, and coaches discuss about this for a long time about like squatting with queuing, about like sitting down or like sitting back.
Yeah. So the cue that has been given for such a long time with the squat is kind of like when we teach a squat, it's like everybody feels like they have to give this cue is to sit back in the squat. And while I think at times that's a good cue, it's not what we should be giving everybody. So I tend to prefer to tell people to sit down. Now, this comes with like the caveat that I work a lot more with CrossFitters and Olympic weightlifters who are doing cleans, front squats, overhead squats, and snatches. The variations of squats that they do, they're in a much better position if they have a more upright torso. They're better able to stabilize weight in those movements. And what happens is when people only focus on sitting back and they initiate all the squats with sending their hips back, that instantly pushes their torso forward. It ends up with them leaning forward more. And I think a lot of times that overemphasis on the sit back cue results in them not getting in the best position for those lifts that they could be in. So instead, what I want to see is that the knees and hips both bend at the exact same time, so that we're spreading the load out between both the knees and the hip joint, not just doing a hinge motion more. And so the cue that tends to, for my athletes, work better is the cue to sit down. And they'll end up sitting their hips back and their knees forward, descending straight down into a squat, and end up being in a better position for clean snatches, overhead squats, and front squats.
And the is the load gonna like the load's gonna be like or the load for the lower back is smaller, am I right?
Yeah. So when you sit back and you lean your torso forward more, that is going to put more load on your low back. And that's it's going to put less on your knees, but just a little bit less on your knees, and they'll put a lot more on the low back. I think that comes down to an overall understanding of what that individual's goals are, as well as what their previous history in terms of injuries are, current injury history are, and their mobility. So it's not that like it's necessarily one way is right and one way is wrong most of the time. It's more understanding that overall. If somebody is squatting to maximally strengthen their posterior chain, their glutes, their low back, then I'm probably going to be a little bit more having them sit back a little bit more. Like if you watch most powerlifters, they sit back in their squat more. But if you're an Olympic weightlifter or a CrossFitter, that style of squat won't translate near as well to your sport.
Love it, love it. So for those coaches and therapists are interested in what we are talking about today, where can they reach out to you?
So probably the best way to go and dive into any of this stuff a little bit more is my website, thebarbellphysio.com. So we talked about a number of different posts. You can look at my Instagram, but Instagram is such a short form piece of content that I feel like you can't really dive deep into things. And so I prefer, if you want to dive deep, go to my website, and there's probably over 150 articles at this point on that website that dive deeper into a lot of these topics than what you can get on my social media. If you want to follow on social media, it's the Barbell Physio on Instagram.
Love it, love it. Appreciate it, man. Appreciate it.
Yeah, enjoyed it.